how unaeka ile mguu haulali painful.
50-year-old Bakari Said is suffering from arthritis in his right knee. His condition, he says, as he was informed by doctors, was occasioned by his body weight.
By then nikaambiwa you need to do some exercise, reduce weight. So nikaanza pole pole, nikawacha kwa sababu ilipoa.
Soon after Bakari stopped exercising, misery struck. He drastically gained weight to more than 130 kilograms and his life took a turn for the worse.
Naamka kwa nyumba, naingia kwa gari, nakuja kwa ofisi nakaa. Nashindwa kutembea hata pale nafanya. Nikitoka hapo kwa msikiti, nashindwa kuenda. I pray in my office.
Bakari was advised to seek services of a nutritionist, a step that went a long way in aiding in weight control and reduction.
Kwa muda wa miezi mitatu from 132, nilimanage kupoteza 16 kgs. By walking, totally scrapping a lot of junky foods, ingano, sima, a lot. Baada ya kupoteza huo uzani, mara moja nikaona mbona siponi goti ndio imeanza kuwa zaidi.
Bakari's condition, however, deteriorated significantly this year, forcing him to suspend various activities, an almost impossible repercussion as a businessman.
Ni ugonjwa mmoja ambao ni mzito sana.
Not only his businesses came to a halt, but also exercises which were much needed.
For the last 6 months, in any position mimi nikiweka mguu inauma. In any position nikisimama, I couldn't take like 15 minutes. Nitaanza kutafuta mahali ya kuketi.
His now painful stage of arthritis has forced him to travel from his home in Mombasa to Nairobi in search of medical treatment.
You start to have pain, a little bit of stiffness in the knee, and occasionally it can worsen to the point that even movement is a problem.
Aside from risk of arthritis that comes with age, Dr. George Adari, an orthopedic surgeon, further elaborates.
We are talking of joints that are referred to as weight-bearing joints. They carry our weight. So because of repeated use, they're bound to wear as we go on in life.
However, there are different levels of arthritis. In the third stage, where most patients begin to seek treatment, the involved organ is usually severely affected, as Dr. Adari says.
They are in extreme pain. They have knee stiffness. For if we take knee as an example, they can hardly bend that knee fully or stretch it fully, which you call extending the knee. And some of them, but rarely, may have a little bit of swelling here and there, again around the joints. They will have deformities. Now deformities is, for example, you have bow legs, which you never had when you were younger, or you have knock knees.
But apart from maintaining good nutrition, how can arthritis be avoided?
In a week you need to be relatively active to the tune of around 150 minutes in a week. That means about 30 minutes per day you should dedicate your body to a bit of what you say aerobic training, where you feel your heart is racing a bit, meaning you're actually stimulating your body to some form of exercises.
After our interview, it was time for Bakari's procedure.
By bringing in the platelets, they'll go and find an environment of inflammation. That activates them. And the next thing they do, they release what we're interested in, called the growth factor. Growth factor is like a signal to the cells that are resident in that knee. When they pick up that signal, they go into what? Rapid cell multiplication, where the cells that are resident there have increased in number to deal with the problem, which is the problem of the erosion of the cartilage.
Bakari's story is a representation of repercussions that are brought about by our often unhealthy lifestyle. The major concern by health experts, however, is what may become of Kenyans and their health in the near future if the current junk consumption and poor exercise culture continues, among other risk factors. Ben Kirera, K24, Health Beat.